Obesity is a complex health condition that affects millions of people worldwide. It's not just about carrying a few extra pounds. Obesity is characterized by an excessive amount of body fat that can lead to numerous serious health issues. At its core, obesity occurs when a person consistently consumes more calories than what they burn over an extended period. All these excess calories are stored as fat, and when this fat accumulation becomes significant, it leads to obesity. However, it's important to note here that obesity is not simply a result of overeating or lack of willpower. The reasons why this happens can be multifaceted and vary from person to person. To define and measure obesity, healthcare professionals typically use a metric called the body mass index, or BMI. BMI is calculated by dividing a person's weight in kilograms by their height in meters squared. While BMI isn't a perfect measure, as it doesn't account for factors like muscle mass or body composition, it's widely used due to its simplicity and correlation with body fat levels in most people. According to the World Health Organization, for adults, a BMI between 18.5 and 24.9 is considered normal weight. A BMI between 25 and 29.9 is classified as overweight, while a BMI of 30 or higher is considered obese. Obesity is further categorized into classes. Class 1 obesity is a BMI of 30 to 34.9. Class 2 is 35 to 39.9, and Class 3, often referred to as severe or morbid obesity, is a BMI of 40 or higher. The prevalence of obesity has reached alarming levels worldwide, making it one of the most significant public health challenges of our time. According to the World Health Organization, the global prevalence of obesity has nearly tripled since 1975. In the United States, for example, more than 40% of adults are classified as obese. This trend is not limited to high-income countries. Obesity rates are rising rapidly in low and middle-income countries as well, particularly in urban settings. Children are also increasingly affected, with childhood obesity becoming a major concern due to the long-term health risks it poses. Causes of obesity. At the most basic level, obesity is caused by consuming more calories than the body uses. However, this simple explanation doesn't capture the full picture. Genetics play a significant role in determining a person's susceptibility to obesity. Some people are genetically predisposed to store fat more efficiently than others, making them more prone to gaining weight. In addition to genetics, several behavioral factors contribute to obesity. Diet is one of the most critical factors, with the consumption of energy-dense, nutrient-poor foods being a major contributor. These foods, which are often high in sugar, fat, and calories, have become more widely available and affordable, leading to increased calorie consumption. Physical inactivity is another significant factor. Modern lifestyles often involve long periods of sitting, whether at work, at home, or in transit, with few opportunities for physical activity. This reduction in physical activity, combined with high-calorie diets, creates an environment that promotes weight gain. Psychological factors also play a role in obesity. Emotional eating, or the tendency to eat in response to negative emotions, such as stress, anxiety, or depression, can lead to overeating and weight gain. Sleep patterns are another factor. Studies have shown that insufficient sleep is linked to weight gain and obesity. Other than that, certain medical conditions can also contribute to weight gain and obesity. These include hypothyroidism, which slows metabolism, Cushing's syndrome, which affects hormone levels, and polycystic ovary syndrome, which can cause weight gain in women. Some medications, such as certain antidepressants and steroids, can also lead to weight gain as a side effect. Symptoms of obesity. The symptoms of obesity go beyond the visible accumulation of excess fat. People with obesity often experience a range of physical and emotional symptoms that can significantly impact their quality of life. Physically, obesity can cause discomfort due to the extra weight, leading to joint pain, particularly in the knees and lower back. This discomfort can make physical activity difficult, creating a vicious cycle where reduced activity leads to further weight gain. Shortness of breath is another common symptom, especially during physical exertion. The extra weight puts additional strain on the heart and lungs, making breathing more difficult. Many people with obesity also experience excessive sweating, as their bodies work harder to regulate temperature. Sleep problems are prevalent among people with obesity. Sleep apnea is particularly common. This is a condition where breathing repeatedly stops and starts during sleep. This can lead to poor sleep quality, daytime fatigue, and a host of other health issues. Beyond the physical symptoms, obesity can have profound psychological effects. Many people with obesity experience low self-esteem, body dissatisfaction, and social stigma, which can contribute to feelings of isolation, depression, and anxiety. These psychological symptoms can create barriers to seeking help and contribute to a cycle of emotional eating and further weight gain. Other symptoms associated with obesity are often related to its health complications. These can include high blood pressure, high cholesterol levels, and elevated blood sugar levels. People with obesity may experience frequent heartburn, constipation, or menstrual irregularities. Diagnosis of obesity. Diagnosing obesity usually begins with a physical examination and assessment of BMI. So, your doctor will measure height and weight to calculate BMI. While BMI is often the starting point, doctors will usually conduct a more comprehensive evaluation. This often includes measuring waist circumference, as abdominal fat, often called belly fat or visceral fat, is particularly harmful to health. A waist circumference of more than 40 inches or 102 centimeters for men or 35 inches or 88 centimeters for women is considered a risk factor for obesity-related health problems. Doctors may also perform blood tests to check for obesity-related health issues, such as high cholesterol, high blood sugar, or hormonal imbalances. They'll likely take a detailed medical history, asking about diet, physical activity levels, family history of obesity and related conditions, and any symptoms the patient is experiencing. It's worth noting that while the BMI is widely used, it's not a perfect diagnostic tool. Some people, particularly athletes with high muscle mass, may have a high BMI without excessive body fat. Conversely, some people, especially older adults who have lost muscle mass, might have a normal BMI but excess body fat. Because of this, some healthcare providers use additional methods to assess body composition, such as skin fold thickness measurements, bioelectrical impedance, or more advanced imaging techniques like DEXA scans. Treatment for obesity. For many people, the first line of treatment involves dietary changes and increased physical activity. When it comes to diet, the goal is to consume fewer calories than your body uses. Start by tracking what you eat and drink for a few days to understand your current eating habits. There are many apps available that can make this process easier. Once you have a clear picture, focus on making healthier food choices. Aim to fill half of your plate with vegetables and fruits at each meal. These foods are low in calories but high in nutrients, which means you can eat more of them while consuming fewer calories. Whole grains such as brown rice, whole wheat pasta, and oatmeal should make up about a quarter of your plate, while lean proteins like chicken, fish, beans, and tofu should make up the remaining quarter. Also, be mindful of portion sizes. It's easy to underestimate how much you're eating, so using smaller plates or pre-portioned meals can help you control your intake. In addition to choosing the right foods, it's important to focus on how you eat. Eating slowly and mindfully can help you enjoy your food more and recognize when you're full, preventing overeating. Also, try to eat meals at regular intervals throughout the day, which can help prevent excessive hunger and reduce the temptation to snack on unhealthy foods. When you do snack, opt for healthy options like fruits, nuts, or yogurt. Physical activity is equally important in treating obesity. The goal here is to increase the number of calories you burn, which can help you create a calorie deficit that leads to weight loss. Walking is a great option for beginners because it's low impact on the joints and doesn't require any special equipment. Aim for at least 30 minutes of moderate intensity exercise, like brisk walking, most days of the week. If you're new to exercise or haven't been active in a while, start with shorter sessions like 10 minutes and gradually increase the duration as your fitness improves. Strength training is another important component of a weight loss plan. Building muscle not only helps you look toned, but also increases your resting metabolic rate, meaning you'll burn more calories even when you're not exercising. Setting realistic goals is essential to maintaining motivation and making sustainable progress. Instead of aiming for rapid weight loss, focus on losing about 1 to 2 pounds per week. This might not sound like much, but it adds up over time and is more sustainable than crash dieting. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. For some individuals, medication may be prescribed as part of their obesity treatment plan. These medications are most effective for those with a BMI of 30 or higher, or for those with obesity-related health conditions such as type 2 diabetes or high blood pressure. Medications like orlistat work by reducing the amount of fat your body absorbs from food, while others like phentermine topiramate or liraglutide work by suppressing appetite. In cases of severe obesity, or when other treatments haven't been effective, bariatric surgery might be considered. There are several types of weight loss surgeries, including gastric bypass, sleeve gastrectomy, and adjustable gastric banding. These surgeries work by restricting the amount of food the stomach can hold and altering the digestive process to reduce calorie absorption. While these surgeries can lead to significant weight loss, they also come with significant risks and require lifelong changes in eating habits. Now, we want to hear from you. Do you or someone you know suffer from obesity? Have you found any specific strategies or lifestyle changes particularly effective? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.